Here are some important facts about coronary artery disease. Heart disease kills about 610,000 people each year. That equals about 25% of all deaths. Coronary artery disease is the most common type of heart disease, killing over 370,000 people annually. Every year, about 735,000 Americans have a heart attack. Americans at risk for heart disease are those in certain high-risk groups, such as people with high blood pressure, high cholesterol, and smokers, are all key risk factors for heart disease. About 47% of Americans have at least one of these three factors. Several other medical conditions and lifestyle choices can also put people at higher risk for heart attacks, such as diabetes, overweight and obesity, poor diet, physical inactivity, and excessive alcohol use. A heart attack happens when something blocks the blood flow to the heart so it can't get the oxygen that it needs. People with diabetes are more likely to have what is called a silent heart attack, where they won't even notice any symptoms at all. Arteries carry oxygenated blood away from the heart to the tissues, except for pulmonary arteries, which carry blood to the lungs for oxygenation. A stent is one way to treat narrowed arteries that supply the heart with oxygen-rich blood. The stent holds open the narrowed artery to allow adequate blood flow to the heart. An X-ray is a common imaging test that lets the doctor view the inside of the body without having to make an incision. Chest X-rays can also reveal fluid in or around the lungs or air surrounding a lung. An EKG is a test that shows the electrical activity of the heart. With this test, the doctor will be able to check the heart's rhythm. Smoking leads to disease and harms nearly every organ system of the body. It is the leading cause of preventable death. The chemicals in tobacco smoke harm the blood cells and blood vessels, as well as many other things. Smokers have about a 70% higher death rate from coronary artery disease than non-smokers do. The importance of exercise in our lives is huge. First, exercising regularly decreases the risk of developing certain diseases, including diabetes, high blood pressure, and heart disease. Exercising regularly for 30 minutes or more most days can help us to lose weight, improve cholesterol, and lower blood pressure by as many as 5 to 7 points. Exercising also strengthens the heart muscles and improves the heart's ability to pump blood to the lungs and throughout the body. As a result, more blood flows to the muscles and oxygen levels then rise. Exercising helps to relax the body and in this way reduces stress. And exercising also has been shown to reduce the risk of diabetes by 50% or more by allowing the muscles to better produce glycogen, which, when impaired, leads to excessive blood sugar and diabetes. A healthy heart is extremely important. This is because we all want to be free of disease and pain and live a long life.